Hi, this is the head and toe assessment for Katie Shipley. I'm working with Dana Rosansky, and I'm just going to scan the room for you. There's nothing in here, but there is my laptop. I'm using that to prop up this cell phone that we're using to record. Okay, I think that's a good location. Okay. Hi, my name is Katie Shipley. I'm going to be your nurse today. I'm going to close the privacy curtain. I'm going to wash my hands, and I'm going to come over here. Can I check your wristband? What's your first and last name?
Dana Rosansky.
And your date of birth?
8/14/93.
Do you have any allergies I need to be aware of?
No.
Any pain today?
No.
Okay, do you know why you're here?
Yeah, I'm at the hospital for a checkup.
Okay, and do you know what the date is?
October 19th, 2015.
Okay, perfect. All right, the patient is alert and oriented ×3. She appears her stated age. Her skin tone is even and appropriate for her ethnicity. She looks clean and appropriately dressed for the situation. Her mood and affect seem appropriate for the situation also. She appeared, and there's no illnesses that need to be addressed immediately, so I'm going to go ahead with my assessment. All right, her face and neck are of the appropriate temperature. It's warm and dry. I'm going to check your conjunctiva. They're pink, which is to be expected. I'm going to check your pupils. So just look straight forward for me. All right, and then watch the pen light as it comes towards your nose with your eyes. All right, pupils equal round and reactive to light and accommodation, and her eyes are symmetrical in the center of her head. Can you open your mouth for me? Check with my pen light in here. All right, her tongue is midline, it's pink. The inside of her mouth is pink. Her gums appear to be taken care of. No receding gum lines, no bleeding. Her tongue is pink, and her teeth are white and straight. And can you open your mouth for me again and say ah? Uvula is active upon phonation, and her tonsils are 2+ bilaterally with no noted discharge. Okay. All right, I'm going to move on to your carotid arteries. And first, I'm going to feel them one at a time to make sure I don't cut off any circulation. And they're 2+ bilaterally. And now I'm going to listen to them with my bell to make sure I don't hear any bruise. All right, no bruise noted. Okay. So for your upper extremities, again, the skin tone is even and appropriate for ethnicity. No lumps, bumps, or lesions noted. No scarring that needs to be assessed. Her skin is warm and dry. I'm going to feel for the brachial pulses first. Those are 2+ bilaterally. The radial pulses, 2+ bilaterally. I'm going to check for capillary refillment of all of her fingers. And that is appropriate. They fill within 3 seconds, so that's what we're looking for, and there are no clubbing present for her nails. All right, so now I'm going to listen to heart sounds. All right, I'm going to start with my diaphragm right here at the aortic area, which is the second intercostal space on the right side. And I'm going to move over to the pulmonic area, which is the second intercostal space left side. I'm going to listen to Erb's point. And both of these, I'm listening to the S2 sounds. And I'm listening here at Erb's point, which is the third intercostal space left sternal border. And right here, I'm listening to both the S1 and the S2 sounds. And right here, I'm listening to the tricuspid area, which is the fourth intercostal space, left sternal border. And right here is the mitral area, which is the fifth intercostal space, the midclavicular line on the left side. And right here, for the tricuspid and the mitral, I'm also listening to S1 sounds, but also in the mitral, I'm listening to the apical heart rate for 1 minute. Okay, and now I'm going to flip over to my bell. I'm going to listen to the same areas to make sure that there's no heart murmurs. And so the mitral, tricuspid, Erb's, pulmonic, and aortic, and I didn't hear any murmurs, no adventition sounds present in any of the heart areas. So now I'm also going to listen to your lungs. I'm going to flip back over to my diaphragm, and I'm going to listen to 10 spots in your front first, starting at the clavicle. So just go ahead and breathe normally. And here I went in an hourglass shape to make sure I got all the lobes of the lungs. All right, can you lift your arm for me? I'm going to listen under your arm. Okay, your other arm. And then I'm going to listen to 10 spots in your back, staying close to your spine and going all the way down. Alright, no adventitious sounds were noted in any of the fields of the lungs. In the front, I heard all tracheal sounds, and in the sides and the back, I heard all vesicular sounds, so that's to be expected. Nothing abnormal found there. Alright, if you could stand up for me, I'm going to check your CV angle. Let me know if there,
Sorry, so you can see.
Let me know if there's any tenderness here.
Nope.
Okay, they were looking for any kidney problems, and if you could bend over for me. Okay, she has a straight spine with an S-shaped curve, and her AP diameter is 2:1, so everything looks good there. All right, now I'm going to have you go ahead and lay down. All right, and I'm going to listen to your stomach for bowel sounds here. All right, so I'm listening in the right lower quadrant, which is where the cecum and appendix are located. And I'm listening in the right upper quadrant, which is where the liver and gallbladder are located. In the left upper quadrant, which is where the spleen is located. And the left lower quadrant, which is where part of the descending colon is located. And in all four quadrants, the bowel sounds are active and present. And now I'm gonna percuss. And as expected, I'm hearing tympanic sounds for hollow organs and dull sounds for dense organs. And then I'm going to palpate, make sure that there's no tenderness in any spots of the stomach. Any tenderness? No? Okay. So I don't need to go any further for that. And I'm also going to check through your stomach. There's no scarring, no lesions, lumps, bumps, anything. Skin is an even tone and appropriate for ethnicity. All right, I'm going to go ahead and have you sit up. No jugular vein distension is noted either. So now I'm going to look at my patient's lower extremities. Her legs are of even color. The lumps, bumps, lesions, scarring, anything that I need to be aware of. Her skin is dry and warm. And now I'm going to feel her popliteal pulses. 1+ bilaterally. I'm going to feel her tibial pulses under her socks here. 1+ bilaterally. And if you could just take your shoes off for me. Perfect. Dorsalis pedis pulses. 1+ bilaterally. I'm going to do the Babinski test right here. All right, and that's negative, and I don't see any edema present either, so that's good to know too. And now I'm going to have you go ahead and stand up. I'm going to do the Romberg test, so if you could close your eyes and keep your arms to your side. I'm going to stand right here, make sure you don't fall. I don't see any swaying here, but I would do it for 30 seconds just to be sure. So right here, the Romberg test is negative. Okay, and I'm going to have you walk down to the room and back. And right here, I'm assessing her gait, and it's natural, no assistance needed, no limping or anything to note. So, and that would be the end of our assessment.